Hello and good morning, everyone. My name is Christy McKenzie. I am the Assistant Coordinator of Neighborhood Services in the Erie County Department of Senior Services. A few things to mention about our program. This presentation is being recorded so that we are going to be able to have you access it at a later date if needed. You can also ask questions by using our Q&A panel to the right side or down below on our control panel. Please refrain from sharing any personal information when submitting your questions. We are going to be answering questions at the end of the presentation today. I would like to take a minute to personally welcome all of you to our first ever 2020 Virtual Elder Law Day Summer Series. This series will continue through the summer, covering a variety of interesting topics. Please be sure to register and tune in every Wednesday. Over the next few moments, you will hear from those individuals that are helping to make this summer series possible.
Hi, I'm David Schenk, Commissioner of Erie County Senior Services. I'd like to welcome you to the 2020 Elder Law Day. Those of you that have had the opportunity to participate in the past, that used to be an in-person event. Obviously, due to COVID-19, our world has changed a lot. And but we still wanted to present this program to you. It is very important. So I'd like to thank the members of my staff, especially Christy McKenzie, who led the effort to make this virtual event possible. We've had a tremendous partnership with the Center for Elder Law and Justice in this project. And I'm really excited to watch the programs, and I'm sure you are too. Erie County Senior Services, we've worked very hard to respond to COVID-19 to still provide for our seniors. Some of the things that we've done after we moved everyone over to home delivered meals, then we took our group programs, our wellness and nutrition, matter of balance program, and we turned those into videos, just like we're doing for Elder Law Day. And they are on our Erie County Senior Services webpage. That's www.erie.gov/senior services, and you'll see the Combat Social Isolation webpage. So we've responded well. I'm very proud of my staff and the support from the county executive's office and the county legislature. And I just hope that you really enjoy the programs this year. Thank you.
Hi, everyone. My name is Karen Nicholson, and I'm the CEO of the Center for Elder Law and Justice. I'm really excited to welcome you to Elder Law Day 2020. We've been doing this event in Erie County for more than 20 years. The COVID crisis has resulted in us having to make several modifications to how we provide services at the center. For one thing, calls to our office have really skyrocketed. But in other ways, we've also had to modify. And one of those, unfortunately, is that we can't do in-person events like this. And Elder Law Day is so important to us that we really wanted to find a way that we can continue this incredible partnership that we have with our former clients and the folks in Erie County. So this year, we are doing a virtual Elder Law Day, and we will be listening to live presentations over the next 3 months. And these will be about issues that are really important to you as older adults and important to people who are your family members and caregivers. So I want to thank Erie County. I want to thank the Lookback Initiative and Mark Mullencar as a David Schenk from the Commissioner of Senior Services. And a particular thank you to all of our volunteer attorneys who took the time out of their busy days today and over the next few weeks to record these presentations for you. Enjoy.
Hi, it's Erie County Executive Mark Mullencar welcoming you to the 2020 edition of the Elder Law Day. Now, this day is a lot different than we've done in the past, and I want to thank our partners with the Erie County Department of Senior Services and the Center for Elder Law and Justice for putting on this video version instead of the one that we normally do in person. I hope you're all safe and well. It's been a very difficult year this last year with the COVID-19 outbreak, but I really appreciate you partaking in this year's Elder Law Day. You're going to learn a lot, even if it's not in person like normal, and hopefully you're going to use these as you move forward in your year and your life. So on behalf of the people of Erie County, thank you once again for doing your best to ensure that we are safe as a community. Always wear your masks when you're out in public, because we are in this together, and hopefully next year we'll meet in person for the 2021 Elder Law Day. Take care, everyone.
Please allow me to introduce our first presenter of the series.
Hello, everyone. Troy Schinzel, Commissioner of Parks, Recreation, and Forestry. I'm here today to talk to you about a new exciting program we've kind of formalized, always been.
Sorry about that. Okay, Kelly is our first presenter. And Kelly is the supervising attorney at the Center for Elder Law and Justice and Healthcare Advocacy Unit. She represents clients in appeals and grievances involving Medicaid, Medicaid managed long-term care, Medicaid, and private health insurance companies. Kelly also serves in a number of coalitions that advocate for clients' healthcare rights in New York State. She has been an active member of the Bar Association of Erie County since 2015 and has served as chair of the Elder Law Committee since 2018. Kelly is also a member of the New York State Bar Association, where she participates in the health law and elder law and special needs committees, and is a member of the Women's Bar Association of the State of New York. I'm going to turn the presentation over to Kelly.
Okay.
Kelly, are you able to share your?
Yep, I am sharing now.
Perfect.
Okay. Ooh, you know what? It started on the wrong slide. I apologize. Okay. Hello, everyone. Thank you for the lovely introduction. As Christine said, my name is Kelly Barrett Sarama, and I work at the Center for Elder Law and Justice. Today's presentation is going to focus on Medicaid basics and current trends, things to watch out for and be aware of in light of the pandemic, and in general in 2020 due to some upcoming changes to the laws. If you're new to the area of Medicaid, buckle up because the rules change almost every single year. So as soon as you adjust, it may change again. So the caveat that if you are watching this presentation outside of the live recording, just double check that you have the most recent data. As a disclaimer, the following content is for informational purposes only. It is not to be interpreted as legal advice, and the information contained is not necessarily specific to your case. So an overview of the Center for Elder Law and Justice, for anyone who doesn't know, is we are a nonprofit law firm. We provide free legal assistance to folks generally age 60 and up. Sometimes we serve folks who are younger if they are certified disabled. And we do also have a varied range of intake qualifications depending on your legal need. So I would recommend just giving us a call to see if you qualify for services. But for example, in the Healthcare Advocacy Unit, we serve folks who are age 60 and up or certified disabled at any age, and we do not have income guidelines. So we are able to serve a very broad range of individuals. The topics that I'm going to cover today, I'm going to briefly touch on Medicare, and I'll explain why when we get to that slide. Then I'm going to go in depth as an overview of the eligibility guidelines for Medicaid and Medicaid managed long-term care. I'm going to discuss some common legal issues to watch out for if you are either a consumer yourself or someone who works with consumers. And then I'm going to just very briefly introduce a pooled trust and talk about what it is. At the end, we will be able to take some questions. If you are not watching this live, my contact information will be on the last slide, my phone number and email. So please feel free to give me a call or send me an email with your questions. So Medicaid versus Medicare. The reason I like to touch on Medicare in any presentation on Medicaid is because oftentimes folks qualify for both insurances and may have both insurances. It is also very easy to conflate the two and confuse them. One easy thing that I learned very early on in this area is to kind of think about it as Medicaid, so we give aid to those with low income and minimal assets, and Medicare, we care for our seniors. So it's just a little tool to try to remember the difference between the two insurances. Medicaid is generally limited to those with low income and minimal assets, with some exceptions. And Medicare is generally limited to those who are age 65 and older, unless you have a few qualifying conditions where you can get Medicare at any age. If you are in receipt of Social Security disability for a minimum of 2 years and you're under age 65, you can qualify for Medicare early. If you qualify for both of these insurances, you are considered dually eligible. So a very brief overview of Medicare, because some folks might be watching and think, why might I need Medicaid if I already have Medicare? Oftentimes, these two insurances are used to complement each other. If you have high medical needs, Medicaid can assist you in paying. And also, as we will get into later in the program, Medicaid is the primary payer of long-term care services in New York State, which means that Medicare is not really the insurance that will cover home care services for the long term as a permanent solution. And Medicare also does not cover long-term stays in nursing homes for either rehabilitation. They will cover some rehab, but if you're there for the long term for custodial care to live in the institution, Medicare is not going to cover your stay, your room and board. So Medicaid will. So very, very briefly, traditional Medicare is in parts. There's Part A for hospital, Part B for doctors. Medicare does not traditionally cover hearing, vision, dental. There are some supplemental plans that you can pay for, but again, that adds costs. And there are Part D for drugs. There are also some private plans that administer the Medicare program where you can lump all of these different parts into one umbrella. And then there are also some subsidy programs that, and I'm going to get into some other subsidy programs that might help you pay for Medicare through the Medicaid program, but just as a very basic. So Medicare savings programs, what are they? These are funded by the state Medicaid program, and they help folks with their cost sharing for Medicare. So it is not full Medicaid, but a Medicare savings program can help individuals pay for their Medicare premiums. And the highest level, if you qualify, there are 3 tiers to the program, even covers your Medicare coinsurance. So if you are a high needs individual, you have a lot of medical issues and you go to a lot of doctors and specialists, you may have very high copays and coinsurance. If you are low income, but let's say you have a lot of assets, there's actually no asset test for the Medicare savings program currently as of the date of the recording of this presentation. So if you are low income, but you have high assets, you may not be a good candidate for the full Medicaid program, but you may qualify for a Medicare savings program and save money through that. One thing to note that a lot of people are unaware of is that you can actually divert excess income into a pooled trust or a supplemental needs trust in order to qualify for a Medicare savings program without applying for full Medicaid benefits. I will touch on pooled trust very briefly at the end of the presentation, but just know essentially if you are over income for these programs, but you're struggling to pay for your healthcare costs, speak to a lawyer. There may be things that you can do to advocate and to get yourself to the qualifying levels. And then just very briefly, there are 3 different programs under the Medicare Savings Program. These are the current income levels, and there is no asset test currently. So resource and income limits for 2020 for the Medicaid program. This presentation is going to focus specifically on the disabled, aged, and blind category, or sometimes referred to as non-MAGI, which is an adjusted gross income calculation. There are several brackets and eligibility categories for Medicaid, and your eligibility does depend on your very specific circumstances. So again, this is just generalized information. This year for 2020, the resource levels, if you are a single individual living alone, you may have up to $15,750 in assets, in available assets. And what we mean by available is essentially anything that could be liquidated for you to access to help you pay for your costs of care. A couple, a married couple, can have up to $23,100. There is a special type of budgeting that I'm going to talk about for married couples where only one needs Medicaid and the other does not, that you can consider. And then the income levels for an individual who is single living alone, $875 a month, and for a couple, it's $1284 a month. So spousal impoverishment protections. Spousal impoverishment is essentially a budgeting scheme that tries to help where there is a married couple, but only one needs Medicaid. So the spouse of a nursing home resident and MLTC, or Medicaid managed long-term care recipient, or a waiver program participant, which is another type of long-term care Medicaid program, may keep a reasonable level of income and resources to live on while still permitting Medicaid payment for the Medicaid recipient's care. Income allowed monthly for a community spouse. Now, the spouse who is not the Medicaid recipient is termed the community spouse. That person can have up to $3,216 of income, and that can be taken from their own personal income in addition to the Medicaid spouse's income. If you have income above that still, then the Medicaid spouse will have what's called a spend down, which we're going to cover in a slide or two. And then resources, you can have a significantly higher amount of resources than you can. If you remember from the previous slide, it was around $22,000 that a married couple can have. But under the spousal impoverishment budgeting scheme, if there is only one spouse in need of the Medicaid program, then the community spouse may have up to the greater of $74,820 or 1/2 of the couple's total combined assets up to a specific limit. So that's a little bit confusing. That's another reason why we do recommend that you call for individualized consultation if you are considering these programs, so that you can have a discussion about your actual assets and where you fall within these eligibility guidelines. But please know that if you think that you're over the guidelines for Medicaid, chances are you might not be, and you may be able to use the program to help pay for your long-term care needs. Okay. What is an income spend down? When an individual or couple has income in excess of their monthly limit, they can still be eligible for Medicaid with a spend down. And this applies to the disabled, aged, blind category only. You have several options to meet this limit. So what a spend down is when you apply for Medicaid, they take into consideration what your income and your assets are. Obviously, there are income limits, as we discussed. So if you are in excess of that, there are certain disregards depending on your situation, which means that there are other things you're allowed to pay for or money you're allowed to set aside before they determine that you have excess. So everyone, for example, currently gets a $20 disregard automatically, and then you are allowed to pay for your Medicare or other health insurance premiums, and then anything left over is typically what your spend down is. Spend down, think of it as basically you literally have to spend down the excess income that you have to the Medicaid level in order to get the Medicaid program. And there are 3 specific ways that you can do that. You can't just go pay any bills. Some folks always ask, a very common question is, I have credit card debt or I have all the other debts. It's not like I have excess money. Unfortunately, there are only 3 specific ways that you can currently manage a spend down. You cannot just pay any bills. If you have unpaid medical bills equal to the excess income or above it, you can supply those medical bills to be considered to offset, so that you can show that actually I'm paying for a lot of medical issues already. I don't have excess income because it's going to the cost of my care. You can pay the excess income amount directly to the Department of Social Services or your Medicaid managed long-term care plan. However, you're directed to do so when you apply, basically like a premium. Or a disabled individual may divert excess into a supplemental needs trust or a pooled trust. And once you divert that, the money is out of your hands and considered spent down appropriately. So again, I will talk a little bit briefly at the end about what a pooled trust is so that you can keep that in mind. And please note, this is important, that for married couples, you can choose between either spousal impoverishment budgeting or use of a pooled trust, when you're in a situation where only one of you needs the Medicaid, you cannot do both. So you cannot have spousal impoverishment budgeting. Let's say you have $4,000 in income. So you're still going to have a spend down because the community spouse income allowance is below that. You can't then deposit the excess from that into a pooled trust. You have to choose one or the other, and that's been litigated and decided by case law. So spending on excess resources. Some folks also have resources above the resource level. What happens? Well, let's say that I'm applying for Medicaid in this bracket and I have $25,000. I'm just shy of $10,000 in excess of resources. So when I go to apply, I'm not going to qualify for the month of July. But if I spend down the resources on allowable expenses, like items for fair market value, a pre-need funeral agreement or burial fund, or let's say I need to redo the roof on my house, then the month after I spend down, I will qualify. So it is July 15th right now is the date of this recording. If I go and spend $10,000, let's say I go set up my funeral agreement, and I set that money aside specifically with a funeral home to pay pre-need, and then I bring myself down to $15,000, I will qualify for Medicaid as of August 1st in doing that. So a warning about this, and I will get to some new rules in the next slide. But there are penalties for transfers of assets if you transfer or gift monies or assets for less than fair market value. So what does this mean? Upon application for Medicaid coverage of long-term institutionalized care, any resources held by the applicant or spouse at any time during the period 60 months prior to the application, which is 5 years, which is known as the lookback period, must be accounted for in order for the applicant to become eligible for Medicaid. So it is strongly advisable to keep receipts for large purchases, essentially anything $2,000 or more in one single transaction, because you will be asked what that money went towards, and you will have to provide an explanation and ideally a paper trail. Any transfer of an asset for less than fair market value, which is just a fancy way of saying any gift, made within the lookback period, again, typically $2,000 or more in a single transaction with some exceptions, will be presumed to have been made for the purpose of qualifying for Medicaid and will likely result in a period of ineligibility for Medicaid coverage of long-term care. And that is currently, as of this date, only applicable to nursing home cases, long-term institutionalized care. However, as we will discuss, there are some new rules coming down the pike in 2020 that establishes a look-back period for community cases as well. So I want to talk about a common scenario where this happens because, transfer of asset for less than fair market value is really just a fancy way of saying, you gifted something. Oftentimes what we see, for example, when people are planning for their future is parents will want their children to inherit their family home, and they will sign over their house to their kids during their lifetime. Sometimes they will retain a life estate, meaning that they essentially own the rights to the home during their life, but as soon as they pass, it passes to their children. Well, that's a big amount of money. That's a big asset, depending on the value of the home, that you have just given away. You did not get money for it. In this scenario, you just signed it over to your children. This will be a penalized transfer of assets for less than fair market value when it comes to Medicaid, which means depending on the value of the asset transferred, you will have your eligibility frozen for a period of time. So right now what this looks like is it's a lengthy math equation that gets done. Let's say you transfer a home valued at $100,000. The state assigns an average regional rate for the cost of care for nursing homes. It's about $10,000. It's more than that, but I'm going to stick with even numbers for demonstration. So let's say you sign over your $100,000 home to your children, and then 3 years later, you need nursing home care, and maybe you didn't expect that, but that's what happens. If you take $10,000 and you take the $100,000 value, you divide that by 10,000, which is the average regional rate assigned by the state, you come up with the number 10. That's 10 months that you will have to accrue a private pay bill at that nursing home because your eligibility for Medicaid has been frozen because you transferred an asset. So that's generally speaking how that works. So this is very important because this is the first time that there has been a community look back. Beginning October 1st, 2020, there will be a 2.5-year look back period, or 30 months, for community-based long-term care applications. It is unclear whether this will impact any existing Medicaid cases when an individual goes to recertify, or if it will only apply to new applications beginning October 1, 2020 forward. As advocates, we obviously hope for the latter. We hope that people already enrolled in the program before October 1st will be safe from this community look back period, but it's a little unclear at this time. So it's just something that we would recommend checking back on if you are an advocate or working with folks in this area. Or if you yourself are applying anytime soon, you're going to want to take a look and call someone in October and talk about what these changes are and what the rules are. Unfortunately, these changes were enacted within the New York State budget for 2020, and there hasn't been a lot of clear guidance issued yet by the state. We expect some to come, but until then, we are just cautioning everyone that there's a possibility it will impact cases in some type of retroactive fashion. And this, to note, only applies for folks who are applying for long-term care. So if you're applying for straight Medicaid, you just need some help going, paying for your doctor's visits, or you're applying for the Medicare Savings Program, the look-back periods will not apply to you. If you are applying for home care services, long-term care services in your home, this will apply to you. If you're applying for a waiver program, this will apply to you. So what is managed long-term care? Managed long-term care plans under the Medicaid program are insurance plans that are paid a capitated rate, which means they get paid the same amount of money for every consumer that's in these plans, by the New York Medicaid program to approve and provide Medicaid home care and other long-term care services to people who need long-term care. The MLTC plans decide how many hours you may receive and arrange for the care by a network of providers. So one thing to know is oftentimes when we, as advocates, speak to folks who are considering, who are having some kind of healthcare needs and they're considering maybe nursing home care, they're not sure if they're at that level yet, we say, the Medicaid program actually pays for home care services, which is something that a lot of people don't realize. And that's why a lot of people, even though you might be over the asset or income limit, you should speak with an attorney, because there is planning you might be able to do in order to try to keep you at home longer and living in the community and out of a nursing home for as long as you can. So it's just one option to explore and to know that a lot of folks don't realize that the Medicaid program does pay for up to 24 hours of skilled care in your home. As we're going to talk about a little bit later, there are some issues with actually getting approved for 24 hours of care. That's a high number, and it's rare to actually be able to get that kind of a case staffed, but it's still worth a shot. And if you have some needs where you're starting to need help with your home chores or your bathing, your hygienic needs, things like that, dressing in the morning, you might be able to get some services through the Medicaid program. And this is the type of plan that you're going to want to seek out. So who must enroll? There are some people who are required to enroll in this type of plan. As of December 2014, when they started to roll out these plans, if you're over age 21, if you're eligible, dually eligible, so Medicare and Medicaid eligible, and you require over 120 days of skilled nursing care a year. A lot of people see that, and they're like, how am I supposed to know how many days of the year I'm going to need care? Through an assessment. So if you are at the point where you're needing some kind of home care, you go through an assessment and then you're deemed eligible or not eligible, essentially. So of note, from 2014 until July 2020, this month, this type of Medicaid covered long-term home care and institutionalized nursing home care. In 2018, the New York State budget, through that, the state decided to carve out nursing home care from MLTC plans and transition it back to fee-for-service Medicaid. The implementation of this, however, has been delayed all of this time. So it's been delayed for about 2 years until this month. So July 2020, literally happening now, nursing home residents are starting to receive disenrollment letters from their plans. They will be automatically enrolled in fee-for-service Medicaid. New applicants, you will be applying for fee-for-service Medicaid when you go into a nursing home. So even though this was enacted in 2018, technically the actual implementation just started now during the coronavirus pandemic. So if you're a first-time enrollee in this type of plan, what steps do you take? 1, you have to apply for Medicaid. 2, you have to contact New York Medicaid Choice, which is an independent contracted agency that the state contracts with to schedule what they call a conflict-free assessment. What this means is a nursing agency will go out to your home to evaluate and assess your needs. They will go through the activities of daily living with you to see, such as, dressing, bathing, meal prep, things like that, to see how much care you need, to see if you qualify for this plan. This is where that 120 days of care per year comes in. A person actually comes out to help determine whether your care needs are at that level. And it's considered conflict-free because they are not employed by any of the actual plans who would end up providing the care. So it's supposed to be a conflict interest-free zone, someone coming to your home who's neutral, not benefiting from it if they end up enrolling you, to assess your needs. When you're approved, if you're approved, you will have 60 days to choose a plan, or you will automatically be assigned one. So you'll get a letter in the mail with the list of plans in your area. You can call around, get screened by multiple to see how much care they can actually give you at that time. Choose a plan. You're going to want to call your primary care physician if they're people you want to keep, because you have to keep in mind you will be within a network of providers. So you want to check with your current network, if you're not looking to change doctors, to see what plans they accept. Those are some of the considerations you have to make. If you don't reply to that letter within 60 days, then you will automatically be assigned a plan. So keep that in mind. And the MLTC plans will create a personalized care plan for you. So important changes to appeal and fair hearing rights that were enacted in 2018, but are actually still working out some kinks. So I wanted to bring them up. When you are enrolled in government insurance programs, such as Medicare and Medicaid, you have the right to an appeal and a fair hearing when there is a decision made that you disagree with. So if there is a coverage decision made that you disagree with, you have the right to appeal that decision. You have the right to what's called a fair hearing, and you have the right to be represented in that fair hearing. And that is something that the Center for Elder Law and Justice does provide for free to folks in this situation. So an enrollee, a Medicaid enrollee, is entitled to written notice at least 10 days before the plan says it will reduce or stop any services. So when you are in an MLTC plan and you get approved for care, every 6 months currently, I believe it's going to be changing to every 12 months, but currently it's every 6 months, you are reassessed to see if your needs have changed. If the plan says they're going to change your care, they have to give you at least 10 days notice before doing that. And then you have the right to appeal that if you disagree with that. There is what's called an exhaustion requirement though. So the enrollee must first request an internal plan appeal and receive what's called a final adverse determination before requesting a state fair hearing. So you used to be able to just go to a state fair hearing if you disagreed with any decision. As of 2018, May 1st, 2018 rather, you have to request an internal plan appeal. So you have to ask the plan to reconsider their choice first and get what's called a final adverse determination. The reason I bring this up, even though the change happened in 2018, is because some plans still are not issuing the right notices, and some notices are still telling people that they can go straight to a state fair hearing. So if you get a notice like that, or you're working with someone who gets a notice that says you can go straight to a state fair hearing and you request a state fair hearing, then there are arguments to be made to allow the judge to hear that matter, even though there was not a final adverse determination. But notice issues are very common right now, and you have to pay attention to what kind of notice you have and what the directions say on it. If you got an improper notice, that is something to be discussed. So the enrollee may request an internal plan appeal orally via telephone, but you must follow it up in writing, or it may not be honored. That is literally written within the rule, and oftentimes people call for appeals because they disagree with whatever's going on, and then the plan can actually say, we never received your request in writing. You want to be careful because there are deadlines for all appeals. Aid continuing. So when your plan proposes to change your level of care and you disagree with that, you can request an appeal. And then if you request it in time, you can request what's called aid continuing, which means that your plan will be required to provide the same level of care unchanged to you until the appeals process is over with entirely. So aid continuing must be requested twice though, which is something to note. So when you request your internal plan appeal, you have to explicitly request aid continuing, and you have to do that within 10 days of receiving the decision, even though your deadline for appeal is far beyond 10 days. So if you request an appeal on the 11th day and you say, oh, but I would like my aids to continue while this is pending unchanged, they can legally deny you that and reduce your care or make the change that they propose to make. If you lose your internal appeal and you go to a state fair hearing, that aid continuing does not automatically carry over. So you got to ask for it again. So just something to keep in mind. And as I did note, for new long-term nursing home Medicaid applicants, the type of Medicaid to apply for is fee-for-service Medicaid. And that rollout, that change is actually occurring right now, July 2020. So major issues that we see in Medicaid and Medicaid managed long-term care plans, things to watch out for. Transitioning from rehab back to the community, or transitioning from what was a long-term care stay back to the community. Particularly now, during the coronavirus pandemic, this is difficult. And particularly now, during the time when the state has decided that this is good timing to change the type of Medicaid that people are in when they are in a nursing home and disenroll them from their MLTC plans. So again, MLTC plans cover home care. If you are in a nursing home, but you want to go back home and you need some home care, MLTC is the plan you want to stick with. So if you're working with anyone or you yourself is in a nursing home and it's during these couple of months and you receive a notice saying you are going to be disenrolled from your plan, you are going to be enrolled in a different type of Medicaid, there could be a massive delay if you allow that to go through without requesting an appeal in you getting back home, because your Medicaid is going to be switched back over. Then you're going to have to get re-screened for long-term care to re-enter the community later. And so you do have the opportunity to appeal when you get the disenrollment notice. If you have the intent to return home during this time, you should definitely request an appeal. You should give us a call and discuss your issues. But definitely red flag, high alert for this specific issue. There are always budgeting concerns. As I said, it gets really complicated because, especially for married couples, depending on what types of assets you have, et cetera. The Medicaid Managed Long-Term Care Program covers environmental modifications, which means if you need a handicap accessible bathroom and you don't have one in your home and you have an MLTC plan and it's medically necessary for you to get some grab bars installed or get a roll-in shower, Medicaid can cover that. There are staffing issues, as I alluded to earlier. So it's more so in suburbs. If you're in the city of Buffalo, you might have an easier time getting your care staffed. However, if you live on the outskirts of the city a little bit, the more rural that you get, the more difficult it is to get cases staffed. And there's a lot of systemic reasons for that. It's a low-paying job. You know, travel and transportation is an issue. It is hard to get cases staffed. It's hard to get the nursing staff, and especially during the coronavirus pandemic, nursing staff has lessened even more. So we just anticipate people having issues getting their care needs met in the community, unfortunately. And again, just more issues to watch for. Confusion about appeal rights. As I mentioned, a lot of old notices are still being used. The difficulty transitioning home, all of those issues are ones to specifically watch out for. So before I move on very quickly to a pooled trust and then move into the Q&A portion, I want to just note that during the coronavirus pandemic, one major shift that we have seen is to telemedicine. I myself had my first telemedicine appointment during the pandemic, and it was very convenient. And Medicaid and Medicare are programs that have covered parts very limited of telemedicine, but they have chosen to expand during this time. And so Medicaid actually covers a very extensive range of providers through telemedicine. And so does Medicare. Medicare has expanded even more. And so that's just something to be aware of. If you're weary of leaving your house and you need some care, you need some medications refilled, you need some kind of consultation, I strongly would advise you to contact your doctor or your provider and ask them if they have a way to set up a telemedicine appointment with you. Medicare and Medicaid are covering a lot of different types of providers through telemedicine right now. Additionally, Medicare and Medicaid both cover coronavirus tests, they cover antibody tests, and they cover treatment with a caveat. It has to be medically reasonable and necessary. Your stays, depending on how long they are in a hospital or rehab, could have some issues. But if you do have the coronavirus or your loved one has the coronavirus and they have Medicare and Medicaid, they can get tested, they can get antibody tested, and they should be able to get some treatment and not have many coverage concerns there. So then shifting, what is a pooled trust? Because I had mentioned it a few times. A pooled trust is a tool that can be used to enhance the quality of life for individuals with disabling conditions. The trust can be used to purchase additional items and services not adequately covered by governmental benefits. The pooled trust must be used for the benefit of an individual with a disabling condition, and the expenditures made on behalf of that person should supplement, not replace, their government benefits. So an individual must be deemed disabled. Essentially, if you're at a point where you're in need of some home care services or you have some higher medical needs, chances are you will be able to go through this process fairly easily. You have to get certification from your doctor and you have to fill out a survey, and then the state has to deem you disabled if you had never been receiving Social Security disability in the past before you turned 65. If you were, then you're qualified and you don't have to go through a formal deeming process because you've already at some point done that. But this is only a tool allowed for folks who are deemed disabled. And just to kind of go through a tiny bit more, so let's say you do have a spend down of $100 a month, or let's go with something higher, $500 a month. You would get your monthly income for that month. You would cut a check for the excess directly to a pooled trust or a supplemental needs trust account, and then you lose direct access to that money. So the Department of Social Services considers it diverted for purposes of satisfying your spend down, but then you would make requests to the trust directly to pay for your expenses. So you can submit your rent, your mortgage payments, your utilities, grocery bills, things like that for the trust to pay those third parties directly. So you don't get a checkbook or direct access to that money anymore. And that is why it's considered diverted. But you still get direction. You still get to use that money for your expenses. So it sounds a little bit complicated. If you have questions or want to talk through more about that, please feel free to give me a call or shoot me an email. It's a little bit more extensive than this presentation calls for today. But that does conclude the presentation. There is a Q&A portion if anyone does have questions. And then there is also an FAQ sheet that I submitted that I believe will be available wherever this presentation is available online, so that you can click on the FAQ. We also have a very extensive blog, and we have been posting a lot of updates and a lot of Medicaid and medical specific updates. So I encourage you to check out the Center for Elder Law and Justice website at elderjusticeny.org to check out our blog. And of course, please feel free to contact me if you have further questions.
Thank you, Kelly. Would you just read off your phone number for folks who are calling in, maybe who can't view your slide?
Sure, yes. So my contact information, again, my name is Kelly Barrett Sarama. And the phone number for CellJ is 716-853-3087. And my direct extension is 229. And my email address is ksarama, S-A-R-A-M as in mom, A, at elderjusticeny.org. So again, please feel free to call me or email me anytime with questions for any healthcare issue, and I'll see if I can direct you from there.
Thank you, Kelly. We have one question so far. If you have SSDI for more than 2 years, they know that you're eligible for Medicare after 2 years, but But do you also get Medicaid automatically, or do you have to apply for it?
So I would say that depends. In most cases, you would have to apply for it. But a lot of people likely would be on the Medicaid program already in that scenario. So again, if you're asking for a specific reason, give me a call. I'd be happy to go through the scenario with you.
Okay, I don't see any other questions. If anybody has any questions, you could type them in. If Kelly's still here for a couple of seconds and figure out an answer for you. Just make sure if you are typing in your question, you're actually hitting send so we can see it. Again, I'd like to thank Kelly for your time, and hopefully everyone learned something new today. And we'll have a brief survey that will follow this presentation. If you could fill that out, we appreciate it. And please continue to check back out at our website at erie.gov/ELD to register for more topics. And we hope to see you back next Wednesday. Our next topic will be covering the basics of estate planning. So, oh, we got one more question. Let's see. Okay. Again, this presentation was recorded. Sorry, we don't have a question. It was just a comment, so that's good. This presentation is being recorded, so we are going to have this on our website for you to access at a later date. And Kelly has also provided an FAQ sheet that we'll post there as well that will kind of go over some of the other information she discussed.
I just have one more note. I will plug that if you're curious to learn more about trusts and how they can be used as tools to help you get the benefits you need, but still retain access to your resources and income, there is another presentation through the Elder Law Day series coming up with Jamie Smith presenting on private special needs trusts and pooled trusts. So check that out.
Thank you all. Thank you, Kelly. Enjoy the rest of your day. We'll hope to see you back here next Wednesday.